Naveen wants to know, how do you grade the quality of embryos?
So that's the big question. Naveen wants to know, how do we grade embryo quality? Well, okay, the classic way of grading embryo quality is by just looking at their structure or morphology. Now, on day 3, they should be 8 cells, preferably equal size cells, less than 20% fragments, and a nucleus in each cell. So those 4 factors will indicate how you grade a day 3 embryo. Now, a blastocyst is very hard to grade. You want to see a good inner cell mass, and you want to see a good trophectoderm, which becomes the placenta. Sometimes it's very, very hard to grade the inner cell mass because it's just a blob. And the angle you see it in through the microscope can be confusing if you're looking at it head on or if you're looking at it tangentially. So in Japan, Dr. Teramoto, who's really the best at this, grades blastocysts only by looking at the trophectoderm, because no matter what angle you're looking at it, it's always tangential, and you see what the quality and the number of the cells are in this outer trophectoderm of the blastocyst. So that's going by appearance. Now, another way to grade embryos is just to biopsy them, to do so-called PGS. Take a little piece of the trophectoderm, like 5 cells or 6 cells, and run it through a chromosomal count. Problem with that is it's error prone. So, so if you have an embryo that is, sorry, I heard some noise out there. So if you have a blastocyst where all the cells turn out to be euploid, that is, a normal number of chromosomes, then that's very likely. That's about a 70% chance that embryo is going to be a baby. 30% chance it won't be, so being euploid isn't all you can go by. It's other factors. But if it's a mixture of euploid and aneuploid, that is abnormal cells, that could be a completely normal baby. 45% chance that you're going to have a pregnancy from that. Be a higher miscarriage rate, but a 45% chance you'll get a pregnancy out of it. And so that means that embryos are a combination of good cells and bad cells, and the good cells outgrow the bad cells. So there's an inherent problem in doing embryo biopsy for grading embryos. We do it for sure if there's recurrent miscarriage or recurrent failure to implant. But to get a little more information, but there's a risk that we may diagnose an embryo as not viable or abnormal that really would be a baby. So you've got to be really intelligent about it and only fiddle with that embryo, taking out cells and doing the biopsy and going through all that if it's really indicated. So those are the 2 ways we grade embryos: by biopsy and genetic testing, or by just appearance. Most of the time, just appearance is what people use.